Good afternoon, everyone. Will Dupree here in the KXAN live studio. We're going to be carrying a live interview that Governor Greg Abbott is doing with Amanda Dugan on KXAN News at noon here in just a few moments. Then we'll get started at about 12:30, so thank you all for joining us at the moment. I want to show you all where the numbers stand for COVID-19 here in our state. This is the latest update that the Texas Department of State Health Services has been able to share at this point. We have hit more than 27,000 total positive cases of COVID-19 in Texas. 732 people have now reportedly died from the virus. There at the bottom, though, you can see that 12,000 people, 12,507 people to be exact, have now recovered after receiving a positive diagnosis of COVID-19. As we await that interview to begin, we also just got some tragic, unfortunate news from Williamson County. Another person has died from COVID-19 there. The county just revealed that 9 people have now died from COVID-19 in Williamson County. 293 confirmed cases, so inching ever closer to 300 confirmed diagnoses of COVID-19. 10 people are currently in the hospital in Williamson County, and now 175 people have recovered after they tested positive for it. Once again, that interview with the governor will be starting here shortly. We'll carry our live signal from the KXAN News at noon here in just a moment, so please bear with us as that's about to get started. We're planning to ask the governor about his reopening plan. The first phase is set to go into effect tomorrow. As we know that the state's stay-at-home order is going out of effect, will become ineffective and expire today. It appears the interview is about to begin, so let's get started and listen in as Governor Greg Abbott does a live interview with Amanda Dugan on KXAN News at noon.
Keeping Texans safe.
Governor Greg Abbott has faced criticism since laying out his plan to reopen Texas on Monday. Phase 1 begins tomorrow. It allows retail stores, restaurants, movie theaters, libraries, and museums to open at 25% occupancy. So we've heard from local leaders who say Governor Abbott's plan opens too many businesses too soon. Meanwhile, some business owners, like cosmetologists, wanted him to open more. We'll ask Governor Abbott about the response to his reopening plan in just a couple of minutes. He'll join us for a live interview here on KXAN News at noon. With that, we get over to Kristen Curry, though. I want to make sure you get your forecast before we talk to Governor Abbott.
Yeah, absolutely. You may kind of jump in there and ask Governor Abbott if we can sneak in pools to phase 1, because we are talking pool weather this weekend, friends. Temperatures in the upper 70s to low 80s out there now. Today is actually one of the coolest days in the 7-day forecast, if you can believe that. We've got upper 80s this afternoon, above normal for this time of year. As far as our wildfire danger goes, because we picked up close to an inch of rain across Travis County yesterday, that has come down since yesterday. Low fire danger across most of our metro and eastern communities, whereas we've got the moderate conditions further off to the west where we didn't see as much rain. Now, looking at our lake levels, both very healthy and full. Buchanan 95% full, Travis at 88, and the water temperature too continues to climb, 71 degrees at last check. But we are turning up the heat. We've got a heat wave to actually start May, with temperatures feeling and looking a lot more like summer than they do mid-spring. So we're going to talk about those numbers. We're also going to show you the drought update that came down this morning. And again, keeping in mind, we did see some rain yesterday, but that's likely not included in this newest update. But it does show good news for Central Texas. I've got those details for you coming up.
All right, thank you, Kristen. Well, more businesses in Texas are about to reopen for the first time in weeks. The first phase of Governor Greg Abbott's plan to jumpstart the state's economy kicks off tomorrow. He joins us live this afternoon to talk about the plan. Good afternoon, Governor.
Oh, good afternoon to you also.
All right, so I want to ask you, here in Central Texas this week, new cases and deaths from COVID-19 are at the highest levels that we have seen since the pandemic has started. So, for example, Mason County, it jumped from 1 case to 17 cases this week. What do you say to critics who believe you are reopening the state too soon and putting Texas at risk?
Very importantly, the decision to open up to the limited extent that we have is based upon recommendations by the best infectious disease doctors, including the doctor at the University of Texas Medical School in charge of tracking COVID-19, but also a former FDA head as well as the head of Medicaid and Medicare. And so these doctors are trained in monitoring the expansion of infectious diseases. But second, know these very important facts. If you really listen to what all the national doctors are talking about, they explain this. As we continue to test more people in the state of Texas, you will see an increase in the number of people who test positive. Also, deaths you'll see an increase in deaths later on in the process. The most important factors are these two factors, and that is, what is the percentage of those who test positive? And so earlier in the month of April, we had about 10% of people who were tested who were testing positive. As of today, that number is about 6%. So the positivity test rate is going down. The second is the number of hospitalizations. So the number of hospitalizations today is actually lower than it was yesterday. And so the most important metrics are all going in the right direction.
Okay, so I know we talked to our experts here in the state of Texas. The White House has advised, though, that waiting until there's been 2 weeks of declining cases before reopening. So why push forward against that guideline?
So you'll know the plan that I proposed was approved by Dr. Birx at the White House. They know exactly what Texas was planning on doing, and they know what the metrics are. And again, it doesn't have to be 14 days of declining every single day. They're looking at trends. And again, the most important trends are these. And that is, what is the positivity test rate for those who are tested? Are you having an increase or decrease in the positivity rate of those being tested? Texas has a decline in the positivity rate of those who are being tested. And then, as the White House has said, as Dr. Birx has said, as the CDC has said, as Dr. Gottlieb has said, one of the most important factors to look at is, what is your hospitalization rate? One of the key factors that the White House and everyone has talked about is making sure that states don't encounter a situation like what New York had, which was a tidal wave of people needing to go to the hospital. Texas has never even come close to needing to access all of the hospital beds that we have, access the ventilators that we have, things like that. We have plenty of hospital space. Hospitalizations are going down, and so all the numbers are moving in the right direction for Texas to be able to open up in a very safe way.
Governor, some of our local leaders, like our Travis County judge, applaud the state for setting minimum safety restrictions, but say it should really be up to the county to set more strict standards. So why should counties with 6,000 confirmed cases have the same restrictions as a county with just 6 cases?
Because we have a state with 254 counties. It would be chaotic if we had 254 different rules and standards, especially as we are dealing with 2 enormous issues. One is a pandemic that spans not just the state and the country, but the entire globe, that knows no jurisdictional limitations, whether it be Travis County or Bastrop County or Dallas County, whatever the case may be. But second, we also have this economic tidal wave that we are dealing with. And it's important that we use standard metrics that are improved by doctors, whether they be doctors of the White House or former FDA administrator like what we have, or the lead infectious disease doctor at the University of Texas Dell Medical School, set the best healthcare standards, who have articulated that the way that we are going about the process of opening up is safe. Let me give you one easy example that everyone knows about, and that is for the past month, grocery stores have been open at a capacity of 25%, where people were able to go in and shop and practice safe distancing practices. That's exactly what we're doing right now with regard to all retail, all restaurants and things like that. These are proven strategies that have been in place that have slowed the spread even while those businesses are open at a limited level.
Okay, quick question here for parents. As you just said, restaurants, retail prepping to get back open here, and that means those people are going to be going back to work. But what about their kids? You know, childcare right now is for essential workers. What should parents in non-essential jobs do for childcare?
So we're working at this moment on trying to expand the child care that is currently available for essential workers to non-essential workers. We understand how critically important this is for working families, and we're working on solutions as we speak.
Can you give us a time frame on when we may have an answer on that?
Well, it's going to be when we have the doctors approve it. Remember this, and that is our decisions are based on medical criteria. And we need to make sure that the medical criteria will exist so that we can have children coming from all these different families, and they have to find ways to make sure the children coming from all these different families will all be COVID-free on a daily basis. And so their goal in providing child care for families is to make sure that children are not importing COVID-19 into a setting like that, and hence leading to a spread. Our primary goal as we go about the process of opening up is making sure we do not do anything that will lead to an increase in the spread of COVID-19.
Okay, Governor, thank you for joining us this afternoon. Well, the live music capital of the world has been very quiet lately. We're going to take a closer look at the new effort to help local musicians make it through the coronavirus pandemic.
All right, everyone. Will Dupree once again here in the KXAN live studio. That was the interview that Governor Greg Abbott did with Amanda Dugan, our noon news anchor, and they were talking particularly about his plan that will begin tomorrow about reopening the Texas economy. That was the top question we asked him, and about, in particular, talking about in Central Texas that new cases and deaths from COVID-19 are at their highest levels we've seen during the pandemic. And for instance, if you take a look at this map right here, on the far left side, so in the western part of our viewing area, Mason County jumped from just 1 case to 17 confirmed cases. And that was just in about a 2-day span. So we wanted to put that into context to the governor and asked what he says to critics who say, you know, a situation like that might be that the state is opening up too soon. And the governor pointed out that he says that they're really looking at 2 different metrics. One, the positivity rate, so how many people are being tested and actually it turning out to be a positive case, and 2, the hospitalizations. Governor Abbott says that those 2 things are going down, so that is a positive indication that reopening the state is appropriate at this time. However, that is still being monitored to see, you know, what decision might be changed in the future, if things need to be dialed back at all. They say they are monitoring that, but that was the top question that we had in particular for the governor. We're going to post this full interview on our website, KXAN.com, and the KXAN News app. You can find it fully there if you missed most of it or any of it today. We want to make sure it's available for all of you. Once again, I want to show you where the numbers stand for our particular area. So these are all the counties that KXAN reaches at the moment. You see that Travis County has almost exceeded 1,600 positive COVID-19 cases, almost 300 in Williamson, and 160 crossed over that mark in Hayes. Finally, we want to point out some of the cases that have jumped up. I did mention Mason out in our far western area there. 17 cases to confirm there at the moment. We are continuing to track these numbers and then pass along that as soon as we can. You can find lots of information and other resources on our website, KXAN.com, and the KXAN News app. Once again, I'm Will Dupree here in the KXAN Live studio. We thank you for watching, and we'll see you back here another time.